Bone dust smells exactly like burnt corn chips. It's a ridiculous, distracting detail, but when a man's chest cavity is cracked open on table 4 and the monitors are screaming a flat line, the brain clings to the absurd. Cora didn't panic. Panic was a luxury she burned out in Fallujah. The clock on the wall of the residence lounge read 3:14 a.m. Cora Davies stared at the red digital numbers until they blurred, her jaw working a piece of stale nicotine gum that had lost its flavor 3 hours ago. She was 34, making her nearly a decade older than the rest of the third-year surgical residents. They had spent their 20s cramming in libraries, fueled by Adderall and panic. Cora had spent hers carrying an 80-pound rucksack through the Hindu Kush, fueled by rippets and a deeply ingrained fear of failure. Now she sat on a vinyl sofa that smelled faintly of ammonia and old sweat, massaging the base of her spine. Her L4 and L5 vertebrae were permanently compressed, a parting gift from a hard parachute landing outside Kandahar. Every time she stood, a dull, electric throb shot down her right leg. She welcomed it. It kept her awake. Davies. Cora didn't flinch. She just turned her head. Dr. Lynn, a first-year intern with dark circles under his eyes and a nervous tick in his jaw, stood in the doorway. He looked like he was about to vomit. Trauma incoming, Lynn stammered. Level 1, ETA 2 minutes. Dr. Weber is the attending, but he wants us down there to prep the bay. Cora spat her gum into a paper towel. What's the meat? Lynn blinked, struggling with her terminology. Industrial accident. Meat packing plant, actually. Forklift pinned a guy against a loading dock. Pelvic crush. Massive abdominal distension. The paramedic said his pressure is barely palpable. Get down there. Start pulling O negative, Cora said, her voice gravelly and flat. Don't wait for Weber to tell you to order it. He's going to be busy yelling at the nurses. Lynn nodded furiously and scurried down the hall, his Dansko clogs squeaking against the linoleum. Cora took a slow, deep breath, expanding her ribs. She didn't feel the sudden spike of adrenaline that she knew was currently flooding Lynn's system. She just felt a profound, heavy irritation. She had 14 minutes left on her shift. She wanted a hot shower and a dark room. Instead, she was about to spend the next 6 hours knee-deep in someone else's catastrophic bad luck. The trauma bay was a stark contrast to the quiet hallways above. It was a brightly lit, tiled arena, smelling sharply of chlorhexidine, bleach, and the metallic tang of dried iodine. A dozen people buzzed around the empty gurney in the center of the room. The double doors of the ambulance bay blew open. The noise hit them like a physical wave, the roar of a diesel engine idling, the frantic wail of a fading siren, and the shouting of the paramedics. They wheeled him in. He was a massive man, easily 250 pounds, wearing a shredded, blood-soaked flannel shirt. His skin was the color of old wax. The smell of him filled the room instantly, a sickening cocktail of raw sewage, diesel fuel, and the distinct copper penny scent of massive hemorrhage. John Doe, crushed between a forklift and a concrete wall, the lead paramedic barked, out of breath. We have a tourniquet high on the right thigh, but his abdomen is rigid. Heart rate's 140, pressure is 60 over nothing. We dumped 2 liters of saline into him. He's not responding. On 3, Cora said, grabbing the slick plastic of the backboard. 1, 2, 3. They hoisted him onto the trauma bed. The man groaned, a wet, rattling sound from deep in his throat. Dr. Weber burst into the room. Weber was a polished 50-year-old attending with perfectly styled silver hair and a reputation for writing brilliant academic papers. In a controlled elective surgery, he was a maestro. In the chaotic, unscripted violence of a level 1 trauma, he was a liability. He liked order. Trauma was nothing but aggressive disorder. All right, what do we have?" Weber demanded, stepping up to the bed and deliberately avoiding the pooling liquid near the patient's boots. "Jesus, look at that distension. Get an ultrasound, Davies. Lynn, where is my blood?" "Ultrasound is useless," Cora said quietly, not moving to grab the machine. She was already pressing her gloved hands into the man's swollen belly. It felt like pushing against a waterlogged mattress. His abdomen is full of fluid. With a mechanism of injury like a crush, he's bleeding out from the liver or spleen. Probably a shattered pelvis tearing into the iliac veins. "I said get the ultrasound, Davies. I need to confirm before we crack him open like a Thanksgiving turkey." Weber's voice pitched up, tight with anxiety. Cora looked up. She didn't glare. Her expression was completely empty. "Dr. Weber, his radial pulse is gone. His carotid is thready. If we wait for imaging, he dies on this table. We need to bypass the scanner and go straight to OR3. For a second, Weber looked like he was going to dress her down in front of the entire trauma team. He opened his mouth, his face flushing red. Then, the monitor above the bed began a rapid, high-pitched shrill. The green line of the heart rate dropped from 140 to 90, then 60. Bradycardia. The man was running out of blood to pump. "Fine," Weber snapped, the panic finally breaking through his arrogant veneer. "Let's move. Pack him up. Call anesthesia. Tell them we're coming in hot." Cora grabbed the head of the bed, unlocking the wheels with a harsh kick of her boot. She leaned her weight into it, steering the heavy metal frame out of the bay and toward the surgical elevators. The chaotic sprint through the hospital corridors was a blur of fluorescent lights passing overhead. The rhythmic slapping of hands performing chest compressions and the frantic shouting to clear the halls. But internally, Cora's mind had already detached. The noise faded into a dull, manageable static. The exhaustion in her spine vanished, overridden by muscle memory. She was no longer a tired resident dealing with hospital bureaucracy. She was back in the dirt. She was analyzing angles, fluid loss, and tactical triage. Operating room 3 was freezing. The air conditioning was cranked down to 60 degrees to keep the surgeons from sweating under the brutal heat of the overhead halogen lights. The room hummed with the sound of ventilators and the rapid, rhythmic beeping of the anesthesia monitors. They slid the patient onto the surgical table. The anesthesiologist, a cynical veteran named Hayes, was already furiously working lines into the man's neck. "Pressure is 40 over barely," Hayes grunted, squeezing a bag of thick, dark blood into the IV line. "You have maybe 4 minutes before his brain goes dark, Weber. You better be fast." Weber was scrubbed, gowned, and vibrating with nervous energy. "Scalpel," he demanded, holding out a double-gloved hand. The scrub nurse slapped a number 10 blade into his palm. Weber didn't bother with a delicate incision. He made a massive, brutal slice down the center of the man's abdomen, from the bottom of the sternum down to the pubic bone. The moment the fascia was breached, the tension in the abdomen released. Dark, maroon liquid erupted outward, spilling over the surgical drapes and splashing onto Weber's gown. It smelled hot, heavy, and metallic. "Suction! Get the Yankauer in there. I can't see a damn thing," Weber yelled, plunging his hands into the cavity. Cora stood opposite him, holding a retractor. She pulled the abdominal wall back, leaning her weight into it. The muscles in her arms burned, but her grip was like iron. She watched Weber's hands. They were moving too fast, jerking through the tissue instead of separating it. He was panicking. "Liver is shattered," Weber stammered, pulling out handfuls of packed, soaked gauze. "Grade 4 laceration. Spleen is avulsed, but that's not where the volume is coming from. He's bleeding from behind, from the retroperitoneum. The forklift crushed him, Cora said, her voice unnervingly calm amid the cacophony of alarms. It probably sheared the inferior vena cava or one of the massive iliac vessels against his spine. You need to pack the liver, ignore the spleen, and find the source. Don't tell me how to do my job, Davies, Weber snapped. He jammed a retractor deep into the abdominal cavity, blindly pulling back on the mess of swollen, damaged tissue to get a better look at the back of the abdomen. He pulled too hard. There was a sickening, tearing sound, like thick canvas ripping in half. The venous bleeding from the crushed pelvis had been a steady, dark flood. What happened next was catastrophic. A high-pressure geyser of bright, arterial red blasted upward from deep within the cavity. It didn't just pool, it sprayed, hitting the overhead lights and ricocheting. The hot, wet stream caught Weber squarely in the face. It hit his surgical mask and forced its way upward, completely coating his safety glasses and pooling in his eyes. "Ah, shit!" Weber screamed, recoiling violently. He dropped his instruments and stumbled backward, entirely blind. He threw his hands up to his face, breaking the sterile field instantly. "My eyes! It's in my eyes! It burns! Heart rate is dropping! He's crashing!" Hayes yelled from behind the anesthesia drape. "I need control of that bleeding right now." Lynn, standing next to Cora, froze. The intern's eyes were wide, staring at the fountain of liquid erupting from the open chest. His hands shook violently. He took a half step back, entirely paralyzed by the sheer volume of the hemorrhage. Weber was staggering toward the scrub sinks, blindly tearing at his mask and glasses, coughing and spitting. "Lynn, clamp it! Get a clamp on it!" he yelled over his shoulder. Lynn didn't move. He couldn't. Cora didn't hesitate. She didn't yell for Weber to come back. She didn't berate Lynn for freezing. She simply dropped her retractor, stepped into the space Weber had vacated, and plunged both hands straight into the boiling heat of the patient's abdomen. It was entirely blind. The cavity was a lake of dark red. She couldn't see the organs, let alone the torn vessel. But she didn't need to see. Her right hand slid through the slippery, gelatinous mass of the intestines, pushing them brutally out of the way. She felt the heavy, damaged bulk of the liver. She slid her fingers beneath it, pushing down through the pooling liquid until she felt the hard, unforgiving ridge of the patient's spine. "Anatomy is just plumbing," an old Navy surgeon had told her once in a tent in Djibouti. "Find the leak, pinch the pipe." Her fingers searched the slick, hot tissue along the spine. She felt a frantic, buzzing vibration, the tearing thrill of a massive artery blowing its pressure into a dead space. It was the aorta, right where it bifurcated, shredded by a shard of shattered pelvic bone when Weber pulled the retractor. Cora dug her fingers in. She formed a claw with her right hand, finding the thick, muscular wall of the torn vessel, and pinned it violently against the man's spinal column. She leaned her entire upper body weight onto her right arm, locking her elbow. Her L4 vertebrae screamed in protest, a jagged spike of pain shooting down her leg. She gritted her teeth and pushed harder, burying her knuckles into the bone. The geyser stopped instantly. The silence in the room was sudden and deafening, broken only by the frantic, rhythmic pumping of the rapid infuser pushing blood back into the patient. Cora didn't look up. She kept her eyes locked on the dark pool in the abdomen. The smell of copper was overwhelming, thick enough to taste. Her gown was soaked through to her scrubs, the fabric clinging wetly to her thighs. Her boots were slipping on the wet floor. "Suction," Cora said. Her voice was barely above a whisper, but it cut through the room like a razor blade. The scrub nurse, staring wide-eyed, snapped out of her shock and shoved the rigid plastic suction tube into the cavity. The dark lake began to drain, revealing Cora's gloved hand, buried deep in the man's core, her fingers white-knuckled and clamped around the pulsing artery. "Pressure is stabilizing," Hayes called out from the head of the bed, letting out a long, shaky breath. 65/40. Climbing. Davies, you got it." Dr. Webber stumbled back into the room, his eyes red and weeping from the saline flush. He looked at the table. He looked at the stopped bleeding. Then he looked at his third-year resident, who was standing perfectly still, holding a dying man's life together with 3 fingers and brute force. "Right angle clamp," Cora said, ignoring Webber completely. She didn't look at the scrub nurse. She just held her left hand out, palm up. "And a heavy silk tie. We have about 2 minutes before my hand cramps, and I am not letting go." Cora's right forearm was on fire. The brachioradialis muscle, locked in a rigid spasm from pinning the patient's aorta against his spine, had started to twitch. 3 minutes had passed. In surgical time, with a man's core laid open to the frigid air of the OR, 3 minutes was an eternity. "I have my vision back," Webber announced, stepping heavily up to the table. His voice was entirely too loud, an overcompensation for the humiliation of fleeing his own surgical field. He shoved fresh gloves onto his hands, the wet snap of the latex echoing in the quiet room. "I'll take over, Davies. Step aside." Cora didn't move. Her elbow remained locked, her knuckles buried deep in the man's retroperitoneal cavity. The dark lake of hemorrhage had been suctioned away, leaving the slick, bruised landscape of the intestines and the shredded fascia. "Davies, I said step back," Webber barked, his face flushing violently above his fresh mask. "If I let go, he bleeds out in 12 seconds, Cora said. She didn't look at him. She was watching the steady, rhythmic rise and fall of the patient's diaphragm under the mechanical ventilator. "I need a DeBakey clamp. Lynn, take the clamp. Slide it exactly down the groove of my index finger. Do not open the jaws until you feel the bone." Lynn, the intern, swallowed hard. He looked at Webber, who was vibrating with rage, and then at Cora, who was as still as a statue. Lynn grabbed the long silver vascular clamp from the scrub nurse. His hands were shaking so badly the metal rattled. "Breathe, Lynn," Cora commanded, her voice dropping an octave. It wasn't a reprimand. It was a tactical instruction. "Stop looking at the hole. Look at the metal. Slide it down my finger. Now." Lynn stepped in. He pressed the cold steel of the DeBakey against the slick, blood-soaked latex of Cora's glove. He guided it down, deep into the abdominal cavity, past the swollen liver, until the tip hit the unforgiving ridge of the L3 vertebra. "I'm there," Lynn whispered, his voice cracking. "Open the jaws, 1/2 inch. Push down, then lock it tight," Cora instructed. Lynn squeezed the ratcheted handle. A sharp, mechanical click, click, click cut through the hum of the machines. "Clamp is locked," Lynn said. Cora slowly, millimeter by millimeter, eased the pressure off her right hand. She watched the crushed purple tissue of the aorta. No spray, no pooling. The clamp was holding. She pulled her hand completely out of the cavity. Her fingers were cramped into a claw, trembling violently. "Pressure is holding steady at 90/60, Hayes called out from the anesthesia cart, adjusting a dial on the rapid infuser. "Good job, kids." Webber shouldered his way into the space Cora had vacated. "All right, give me a 3.0 Prolene on a Castroviejo needle driver. Let's clean up this mess." Cora took a step back, letting her arms drop to her sides. The adrenaline crash hit her instantly. The dull electric throb in her lower back flared into a blinding spike of pain, forcing her to shift her weight onto her left leg. Her scrubs were soaked with the patient's fluid, clinging coldly to her skin. The smell of the room, a heavy metallic rot mixed with the sharp bite of ozone from the electrocautery pencil Weber was now using, made her stomach turn. She watched Weber sew. He was fast, she had to give him that. But he was rough. He threw his stitches with an arrogant flick of the wrist, tearing tiny, microscopic margins of the fragile arterial tissue. It would hold, but it was ugly. 45 minutes later, the abdomen was packed with temporary gauze and covered with a clear vacuum dressing. The patient was unstable, comatose, but alive. "I'm going to go update the family," Weber said, peeling his gown off and tossing it onto the floor, ignoring the red biohazard bin 3 feet away. He looked at Cora, his eyes narrowed. "You stay and help transport him to the ICU. Then go to the locker room. Do not speak to anyone until I call for you." He walked out, the heavy metal doors swinging shut behind him. Cora walked over to the scrub sink. She kicked the foot pedal, letting the freezing water blast over her forearms. She scrubbed her skin with a rough sponge until it was raw and pink, watching the dark, diluted red swirl down the stainless steel drain. She didn't feel heroic. She just felt deeply, profoundly tired. She needed nicotine, and maybe a bourbon. The chief of surgery's office smelled like lemon polish, old leather, and stale coffee. It was located on the top floor of the hospital, far removed from the windowless, fluorescent purgatory of the surgical wards. Dr. Richard Gallagher sat behind a massive mahogany desk. He was a 60-year-old man who looked like he had spent the last decade running on 4 hours of sleep a night. He didn't wear a white coat. He wore a rumpled tweed jacket and a tie that had been loosened 3 hours ago. Weber paced the length of the Persian rug, gesturing wildly. Cora sat in a heavy leather chair in the corner. She sat perfectly still, her spine straight, her hands resting flat on her thighs. She had changed into fresh, stiff scrubs. The sharp pain in her back had settled into a familiar, grinding ache. "It was a complete breakdown of the chain of command, Richard," Weber spat, turning on his heel. She broke the sterile field, she commandeered the table, and she gave unauthorized orders to an intern. It was reckless cowboy behavior. If I hadn't stepped back in to repair the aorta, that man would be in the morgue. Gallagher didn't look at Weber. He was staring down at a tablet on his desk, his thumb slowly swiping through the digital pages of the operative report. She shoved her bare hands, well, gloved hands, but blindly, into a massive retroperitoneal hematoma. "It's a miracle she didn't avulse the renal arteries," Weber continued, his voice rising. "She needs to be suspended. Formal reprimand, a stain on her jacket." Gallagher tapped the screen of the tablet, locking it. He looked up. His eyes were cold, grey, and completely devoid of sympathy. "David," Gallagher said, his voice quiet. It was the kind of quiet that immediately sucked all the oxygen out of the room. "Shut up." Weber stopped pacing. His mouth hung open slightly. "Excuse me?" "I said, shut up," Gallagher repeated, leaning back in his chair. He steepled his fingers. "I read the anesthesia flow sheet. I read the scrub nurse's charting. And I just spent 5 minutes talking to Lynn, who looked like he was about to have a nervous breakdown in the cafeteria." Gallagher turned his gaze to Cora. "Dr. Davies." "Sir," Cora replied, her voice flat, devoid of inflection. "The flow sheet says the patient's pressure dropped to undetectable at 0342. At 0343, Dr. Weber sustained a fluid strike to the face and broke scrub. At 0344, the pressure rebounded to 60/40 and held." Gallagher paused. "Who clamped the aorta, David?" Weber swallowed, his face suddenly looking very pale. I instructed Dr. Davies to acquire vascular control while I flushed my eyes. That's a lie, Gallagher said simply. He looked back at Cora. You did it manually, blind. Yes, sir, Cora said. How? Cora blinked. She hated this part, the civilian need to dissect instinct. The geometry of a crush injury is predictable. The forklift hit him anteriorly. The organs displace laterally. The spine doesn't move. The aorta is tethered to the spine. I bypassed the displaced tissue, anchored my hand against the L3 vertebra, found the pulse, and applied mechanical pressure. Gallagher stared at her for a long time. The silence in the office was heavy, broken only by the faint, distant hum of a helicopter landing on the roof 3 stories above them. Who pulled off the impossible surgery? Gallagher murmured, almost to himself. He looked at Weber, a look of profound disgust on his face. When I asked the charge nurse who stopped the bleeding on a blown aorta without a clamp, she said, just a resident. Weber tried to salvage his pride. Richard, the technique was wildly unsafe. The technique, Gallagher interrupted, standing up, is the only reason you don't have a death on your morbidity and mortality report this month. A grade 4 liver laceration and a ruptured aorta. The mortality rate on that table is 99%, and you survived it because your third-year resident has better tactile anatomy in the dark than you do under halogen lights. Gallagher pointed a finger at the door. Get out of my office, David. Go finish your charting. If you ever try to throw a resident under the bus to cover your own panic again, I will personally revoke your operating privileges. Out! Weber's jaw tightened. He looked like he wanted to argue, but the absolute zero temperature in Gallagher's eyes stopped him. He turned and walked out, shutting the door a little too hard behind him. Gallagher sat back down. He rubbed his eyes, suddenly looking very old. He opened a drawer, pulled out a thick paper file, and tossed it onto the desk. I pulled your file, Davies, Gallagher said. Cora didn't move. I figured you would. Stanford undergrad, top of your class, then a 10-year gap, Gallagher said, tapping the folder. Your application to this residency simply said United States Navy, classified. I had to make 3 phone calls to the Pentagon just to get them to confirm you were honorably discharged. Cora remained silent. Blind packing a retroperitoneal bleed in under 10 seconds, Gallagher continued, leaning forward. You don't learn that in a textbook. Where did you learn that? Cora looked past him, at the window. The sun was coming up over the city, casting a harsh, pale light over the concrete skyline. The electric pain in her leg throbbed in time with her heartbeat. Korangal Valley, Ramadi, a few places that don't have names, Cora said quietly. A 7.62mm round from an AK-47 does the exact same thing to an aorta as a shattered piece of pelvic bone. You learn to find the leak, or you put them in a bag. Gallagher slowly nodded. He didn't offer a platitude. He didn't thank her for her service. He was a surgeon. He knew that trauma didn't make you a hero. It just made you tired. You're a nightmare for my attendings, Davies, Gallagher said. You're arrogant, you don't communicate, and you scare the interns. I'm working on my bedside manner, sir. A tiny ghost of a smile touched Gallagher's lips. Don't. The hospital has enough politicians. We need mechanics. He tapped the desk. Go home, Cora. Sleep. You're on rotation with me tomorrow. We have a Whipple procedure at 0600. Don't be late. Cora stood up. The joints in her knees popped loudly in the quiet room. Yes, Dr. Gallagher. She walked out of the office, down the carpeted hallway, and into the elevator. When the doors closed, she finally let her shoulders slump. She leaned her head against the cool steel of the elevator wall and closed her eyes. She survived the shift. The patient survived the table. Tomorrow the alarms would scream again, the blood would spill again, and the clock would reset. She dug her hand into her scrub pocket, pulling out a battered piece of nicotine gum. She popped it into her mouth, chewed twice, and tasted nothing but ash. That's how you survive the impossible. No magic, no miracles, just muscle memory forged in hell. Cora Davies doesn't want your applause, but I'd love to hear your thoughts. Would you want a renegade like Cora in your corner when the monitors flatline? Drop a comment below, smash that like button, and share this story with someone who loves gritty medical drama. Don't forget to subscribe for more intense, untold stories from the surgical front lines. See you in the next one.